Welcome to this edition of the First Aid Show. In this video, we spoke to Professor Sam Mohiddin, a consultant cardiologist, when filming our ToBe Heartsafe training course, and asked him about the screening program.
The screening program essentially is evaluating children and young people over the age of 14 up to older teenagers and 20s, looking to see if there's any evidence that any of those individuals might have one of the disorders that we know can cause cardiac death. And to do this, we ask them to complete a questionnaire, asking questions that are designed to help us detect symptoms or the context with which these disorders can occur. So, for example, many of these disorders occur in families, and so trying to determine if there's a family history of similar conditions is an important part. The questionnaire also asks individuals if they have any of the symptoms or signs. For example, one very important symptom is feeling faint or passing out. There are other questions that we also go into. All people who are being screened then will undergo an electrocardiogram or an ECG. And the ECG effectively measures and maps out the electrical signals produced by the beating heart. And this is important because many abnormal hearts will produce electrical signals that are different from normal hearts and allow us to detect some of these conditions. For most people who we screen, those tests are sufficient. And if they are both completely normal, the questionnaire and the ECG, we often don't need to do very much more. However, if there are concerns from either the ECG or the questionnaire, we'll want to do more tests. And one of the most important tests is to take pictures of the heart using something called an echocardiogram. An echocardiogram is a very painless way of looking at the heart, very safe, and we can do it there and then on the same day as we do all the other screening tests in people that need to have this done.